Hello and welcome. Today, we're diving into a rare and intriguing condition affecting the urinary system, urethral malakoplakia. Join us as we explore its causes, how it develops, and what can be done about it. The exact cause of urethral malakoplakia remains somewhat elusive, but it's generally understood to be associated with chronic bacterial infections, particularly E. coli. Immune system deficiencies, whether congenital or acquired, also play a significant role. Conditions that suppress the immune response, such as organ transplantation, diabetes, or long-term steroid use, can increase susceptibility. Let's delve into the how behind this condition. Malakoplakia arises from a defect in the ability of macrophages, the body's scavenger cells, to digest bacteria properly. These macrophages ingest bacteria, but are unable to effectively break them down. This undigested material accumulates within the macrophage cytoplasm, eventually forming characteristic structures called Michaelis, Gutmann bodies. These bodies, containing calcium and iron deposits, are the hallmark of malakoplakia and can be found within the lesions. Urethral malakoplakia is a rare condition, and precise epidemiological data is limited. It is observed more frequently in immunocompromised individuals, including those with diabetes, organ transplant recipients, and those on immunosuppressant medications. It can affect individuals of any age, but is sometimes seen more often in middle-aged and older adults. It is not considered to be contagious. The symptoms of urethral malakoplakia can vary, depending on the extent and location of the lesions. Common presentations include dysuria or painful urination, urinary frequency and urgency, and hematuria or blood in the urine. Some individuals may also experience urethral discharge or discomfort. In some cases, the condition can be asymptomatic, only being discovered incidentally during other investigations. Diagnosing urethral malakoplakia typically involves a combination of clinical evaluation, imaging studies, and tissue biopsy. Urine cultures can help identify any underlying bacterial infections. Cystoscopy, a procedure involving inserting a thin tube with a camera into the urethra, allows for direct visualization of the urethral lining. The definitive diagnosis, however, relies on histopatological examination of a biopsy specimen, confirming the presence of the characteristic Michaelis, Gutmann bodies within macrophages. While malakoplakia can occur in other parts of the urinary tract and other organ systems, in the urethra it presents primarily as a localized or, at times, diffuse inflammatory process. The lesions can vary in size and appearance, sometimes appearing as raised plaques or nodules. Treatment for urethral malakoplakia typically focuses on addressing any underlying infections and boosting the immune system. Antibiotics are used to combat bacterial infections. Cholinergic agents like bifenacol may improve macrophage function. In some cases, surgical removal of the affected tissue may be necessary, particularly for localized lesions. Immunomodulatory therapies, such as vitamin C, may be considered to enhance immune function and promote bacterial clearance. As urethral malakoplakia is often linked to immune deficiencies and chronic infections, preventative measures largely revolve around managing these underlying conditions. Good hygiene, prompt treatment of urinary tract infections, and careful management of immune-compromising conditions like diabetes can help reduce the risk. The prognosis for urethral malakoplakia varies depending on the severity of the condition, the patient's overall health, and the effectiveness of treatment. With prompt diagnosis and appropriate management, many individuals experience a good outcome. However, recurrence is possible, especially in those with persistent immune deficiencies. Recent research is focused on improving diagnostic techniques and exploring novel immunomodulatory therapies to enhance macrophage function and prevent disease recurrence.